Hi, let's talk about the renal arteries and veins. So the renal arteries and veins are going to be at approximately the level of the L1 vertebra. And here the veins have been removed so that we can see the left renal artery. And we can see that left renal artery dividing into several segmental arteries. As you may recall, there are approximately 5 renal segments. So there's an apical segment, an inferior segment, a superior anterior, an inferior anterior segment, and then a posterior segment that would be behind these. So with those 5 renal segments come typically 5 segmental arteries, which are end arteries. There are also opportunities, and these are very common, for accessory renal arteries. And accessory renal arteries may either be hilar arteries, and this is an example of one of those hilar arteries, or they may be polar arteries, meaning they may go out to either the inferior or the superior poles of the kidneys. Now, looking more anteriorly, we can see the renal veins, and the left renal vein is much longer than the right renal vein. It's typically about 3 times as long, and that's because it has to cross over the abdominal aorta. We can see that classic relationship between the left renal vein and the superior mesenteric artery, which we'll come back to in a second. But first, I want us to appreciate all of the tributaries of that left renal vein, which would typically drain into the inferior vena cava on the right side. So these are going to include the left inferior phrenic vein, the left suprarenal vein, and the left gonadal vein. So on the left side, blood from the diaphragm, the suprarenal gland, the kidney, and the left gonad all drain into the left renal vein. So this is setting the stage for renal vein entrapment syndrome, or nutcracker syndrome, where there is an impingement on that left renal vein, typically due to an abdominal aortic aneurysm that traps that left renal vein between the SMA and the aorta. Thank you very much for your time.